guys, thank you for stopping by. My name is Satini. Welcome to this highly requested video, and that is the HCA healthcare assistant or slash nurse assistant slash care assistant interview questions. I have attended interviews for healthcare assistance posts in the past, and these are the questions that have normally come up. I know Google may seem like the best place to find answers to interview questions, but there are some interview questions that will come up in the interview that will surprise you that most of the time you will not find on Google. This may be a lengthy video, so get a cup of tea, be comfortable, and let's get right into this video. So I'm going to be looking down on my phone because I've written down all the questions there, and I'm going to be referring to the questions to my phone as I look at the questions. I've divided the questions into 5 categories, and this is questions that will be based on your current workplace, questions that are technical or work-based in terms of when you are actually on the floor, and personality related questions, privacy related questions, and interview preparation requested questions. These are more or less to see if you actually prepared for the interview itself. So starting off with your current workplace questions, so what an interviewer will do is that they will try and see that in your current job, are you doing tasks or duties that are similar to what you will be doing in this current job? Here they're trying to access whether they're trying to access what you're doing in your current job to see if the experience that you have meets the requirements for this post that they've advertised for. So what they will mainly do is they'll mostly ask you to take us through your morning routine. This is not the time to talk about your morning routine at home. They're talking about your work morning routine. The important points to cover in this is it's important to talk about food and fluid charting. This is how you are going to check. This is how you are going to check that each patient is getting the right food in terms of dietary, as there is diets such as soft diet, minced moist diet, and normal diet. So they will want you to go into depth into this. What you will also need to talk about is about the care that you provide in the mornings. So mostly they will ask you, what do you do in the mornings? You need to talk about your handover process. You need to talk about the morning care that you provide for your residents. And you also need to provide details on when you serve breakfast. And you also need to talk about how you're capturing all the things that you've done. Also touch on things such as safety checks, as they will find that important, that are you aware with what is going on with all the rest of the residents on your floor when you are when you are at every point of the day. It is important that you talk about strategy as well, delegation if you're a senior care assistant, and teamwork as well, as that is very crucial in the morning. And they will ask you in-depth questions related to charting, especially what system you guys are using at your current workplace. And it's important that you understand and have knowledge of that. They will ask you why you have decided to leave your current job. This is not the time to shed bad light on your current employer. This is not the time to badmouth your current employer, irregardless of how bad they are, as this may come across as if you're a complainer, So I would avoid saying anything negative about your current employer, saying things like, oh my gosh, we're always short-staffed, oh my gosh, we're underpaid, because that just comes off as if you're just looking for more money, which is not bad, but unfortunately interviewers don't really like to hear that. So what I would say is that touch on things like, you want to acquire different experience now, you've reached the ceiling where you've worked. Paint your current employer in a positive light, and paint this that you are just looking for an opportunity to grow in a new company. It is important as well, when you are talking about the morning care, that you showcase your bedside manner. This is how you communicate with patients in the morning. It is important that when you're telling them your day-to-day tasks in detail, like when you're providing care for a resident, it is important to mention that you knock, greet, and let patients know you're about to switch on lights, ask for permission to open blinds, inform the patients of what they're eating. And this is important that you say things like this, as it gives them clarity of what your bedside manner is like, and it just gives it shows that you're not just that person who just rushes into a resident's room because that's their room, but technically that is their home, that is their private safe space. So imagine someone just budging into your room and just giving you food, or suddenly just opening the blinds and the lights. You would feel like your privacy is invaded. So it's important that you mention that in the interview process, that you knock first, you greet them, you ask for permission to do things. It is also important that you, in between this, you mention how you're practicing infection control, washing hands in between rooms. If there is if a certain resident has an infection, how you keep that infection control in place, the infection control measures that you would have in place. It's important that you mention all of this. It's also important that you mention that you include patients in choosing. Something that is a lot of residents complain about when they're in a nursing home is that they feel like their choice has been taken away. So it's important that you mention to residents that, look, that you mention in your interviews that you give the residents option to choose which you should be doing on your job. And for example, if you are putting together clothes that they're going to wear on that day, it is important that you ask them, give them options. What do you feel like wearing today, Mary or Anna, whatever her name is? What do you feel like wearing today? Would you like to wear this, or would you like to wear that? The weather is lovely today. Would you like to wear, something short sleeved? Give them options. Giving them options, giving residents option makes the resident, feel like they have some control as well in their life, and it puts them in a better mood as well. And it's important as well to understand and acknowledge if they say no, they don't feel like waking up and dressing up yet. That is okay. You don't force them, and you should mention this in your interview, that what you would do is you would put that on the chat that they refused care at this time and you came and tried again a little while later. And sometimes you'll come like an hour later and they'll be happy to wake up. They just needed that extra 5-minute lay-in. When it comes to technical based interview questions, what I would suggest is that keep all the course material that you go through when you're studying, and then before your interviews, go through that course material, as you will find answers to some of those questions in your course material. So they will ask you things like how to change a catheter. That's just the catheter bag, not the catheter, the inserted catheter itself. How to change a colostomy bag. How to avoid pressure sores is a prominent question that has come up as well. And how to deal with needle pricks. How to deal with spillage or accidents or fluids going on the skin. What to do when you have been bitten or scratched by a resident. Some fire safety questions may come up. They don't often come up, but they have come up before, because these are usually different for most employers, like there'll be different exit doors and all that, but there is sort of fire training that is standard to all workplaces. So they will ask you things like, so if there is a fire, what do you do before you enter the room? If you think that there is a fire, what do you do before you enter that room? You need to mention things like putting your hand against the door with the back of your hand to feel the heat. You need to mention, if you guys have walkie-talkies, that testing the walkie-talkie before you go and check the fire. All those things are things that they may come up with What size of fire can you tackle? And that's a fire that is smaller than a bin size, like the paper bin size. Anything bigger than that is out of your control. We're calling the fire brigade. They will ask you questions like that on fire safety. What do you do when you find a patient that is not breathing or a patient on the floor? It is important of talking about not moving the patient, talking about ringing the emergency bell immediately. If you have CPR training, that means that you can talk more about your CPR training there. They will ask you wound care questions. These are usually for nurses, for registered nurses, but they may ask you, especially if you're looking for a hospital-related job, they may ask you for wound care questions. They may ask you for palliative care. They may ask you palliative care questions. Palliative care is somebody who is now, could be bedridden and, their life is slowly coming to an end. In most nursing homes, they say that the moment somebody arrives in a nursing home, they are considered palliative because that is their last home. I found that very sad, but that is their last home in this life. But they will ask you a lot of palliative related questions, giving somebody who's on palliative care water, food, how you caring for somebody on palliative care, how you caring for the family of the person who's on palliative care. I did palliative care training, and it's a very eye-opening module. It's a very emotional module as well, and it's a highly suggested module, I would say, as well, especially if you're looking to work in a nursing home or in a palliative care unit in a hospital. What do you do when you find a staff member or another resident abusing a resident? What do you do when you think a resident is being abused? It is important not to just say, I'm just going to go and tell somebody. It is important that you stop the abuse immediately when you see it happening. You remove the resident from the situation, and then you do a report, you file a report, you get a witness if there's a witness nearby, follow up and make sure that complaint was filed. It's a very important question, and previously in the past I failed that question in one interview because I said immediately I would call senior management, but you're still leaving the resident in the care or with the person who's abused them, which is not safe. Personality related questions. They will ask you to tell us why you want to work as a healthcare assistant. How would you describe teamwork? How do you manage stress? What has been the most challenging part of your career? Where do you see yourself in the next 5 years? Give an example where you had to display good leadership qualities. How do you handle working with difficult teammates? How do you support each other given limitations and skills? This is your time to shine. This is your time to showcase. This is the time to sell yourself as a HCA candidate. It's important to think about these questions in depth, as they most likely will come up in the interview process, and have answers to these questions that can make the potential employer say, okay, this is a candidate that we would like on our team. Privacy related questions. What I would suggest is that familiarize yourself with GDPR laws. What do you say? A question that normally comes up in interviews is, what do you say when a person calls in asking for information on a patient? What do you do when a patient tells you something in confidence? This one is a bit of a difficult one because it can come across, the interviewer you may say, oh, if a patient tells me something in confidence, I keep everything they've said in confidence. But the interviewer may also say, what if they're telling you something about how they want to self-harm themselves, how they want to commit suicide, when a resident has suicidal thoughts, that is a different situation altogether. You don't keep that private anymore. You tell management. They'll possibly call in a meeting and tell all the colleagues on the floor so that everybody is aware. And you would put 15 minutes check on the residents. So every 15 minutes you're going in to check on them to make sure that they're okay and they haven't harmed themselves. How do you keep your colleagues' privacy is a question as well that may come up. This is things like just not talking about your colleagues that you work with other people, not talking about, how they work with other people. It's just keeping their privacy as your colleagues. Now, the last section is interview prep questions. This is more to see if you're prepared coming to this company for an interview. So what they will ask you is, tell us what you know about our company. I have made a mistake in the past of not really researching the company that I'm being interviewed with, because you just think, okay, it's a hospital. Nobody's going to ask me about the hospital. I'm just going to be like, it's a hospital. But in fairness, they will ask you questions about, when were we established? What type of services do we provide? So it's important that you're up to date and you know at least a good basic of what the company is about or what the hospital or nursing home is about, because you may come across as, someone who's not very interested in the role and who didn't research the company that they're being interviewed at. So yeah, guys, that is it for this video. I took the liberty of finding links to what I think had the best HCA or healthcare assistant questions, as I obviously cannot cover all questions. So please check this out in the comment section and go through these questions as well on Google, as you may find that one or two may come up on your interview. And if there is a particular question that you found interesting, pop it in the comment section and tell me how you would respond to it, and I can give you my thoughts on that. So yeah, guys, thank you very much if you stayed this long into the video. Good luck in your journey, and I will see you in the next one. Goodbye.